Right, hello. I'm joined today by Professor Christian Mehl from Germany. And Christian owns a practice in Germany, quite a large practice, employs 35 people, and he also has a practice in Wimpole Street, employing 10 people. And I've asked Christian to give us some insights into how he thinks we've handled the corona crisis from a dental perspective in the UK. And then a little bit later, we'll talk about how the German dental experience through corona has happened and how it's been managed. So Christian, would you first of all like to introduce yourself to my viewers?
Will do. Hello, and thank you very much, Jonathan, for having me. And I mean, we've been going back and forth, and thank you very much for pushing dentistry back into the agenda as well. I'm really grateful for you to do that. And my name is Christian Mehl. I'm born in East Germany, which is important in this context. I went on to study in Kiel, Germany, which is famous for submarines. I did 2 specialist degrees in prosthodontics and implantology, and have then, from 2007 to 2011, been in London, and I wasn't quite confident enough to open up a practice there, so I went back to Munich, Germany, and we started this practice from scratch. That means my partner and myself and an apprentice, and now 35 people. And my wife didn't like it here in Germany, so she loved London more than anything in the world. So I was forced to go back and own a practice now in Wimpole Street in the medical district in London as well.
How long have you been in London owning your own practice?
I mean, being a director, I've been director at Swissmar for a year, been there for 4.5 years. And now I just bought the clinic in December 2019.
Right. Good.
And we invested quite heavily, and then when we finished, we were forced to close. So yeah,
so it's been a little bit of a nightmare for you.
Yes.
Yeah.
It was some pressure.
Okay, so don't pull any punches, Christian. Tell us.
I'll never do.
Okay, tell us your view of how the UK has handled COVID from a dental perspective.
I will go a little bit wider because I have to say England is my country now, it's my home. So as a German, we have very high respect for England because they defeated us twice in the world wars. So you're born with a respect for England. It's just like this. England and Bavarians, actually. So because Bavarians fight and drink. So yeah. This is my history. So when sometimes we understand that this is a different culture, but we're not quite sure sometimes why they do things the way they do it. And I think England has been a little bit unlucky with this corona crisis because it had a little bit inexperienced. I'm a Tory member, I have to say, so it's my party which is messing it up at the moment. And it's a very inexperienced government, young government. They haven't been in the jobs for a very long time, and they have been chosen mostly by the pedigree towards Brexit. And the crisis now is completely unforeseen, and Brexit they would have maybe handled well, but for this crisis they were ill-equipped. Advantage compared to Germany is we have a government we would like to get rid of. I would like, because I've seen them now for 16 years.
16 years? Wow.
Yeah, Chancellor Merkel is Chancellor for 16 years. If you're 16 years old, you have never seen another Chancellor in your life. So it's her 4th term now, and next year's election. So I think she will step down then, but it's a long time. So government a little bit inexperienced, and I think they have taken the decision to empty the hospitals and send the old people which have been in the hospitals back to their care homes. That's not a great idea, and because they introduced a virus risk group. And then dental-wise, Germany was very simple. I mean, they forced us to stay open. We were not allowed to close because we were considered essential services. So we were not allowed to close, and of course we didn't want to close because there would have been bankruptcy for us and London. Yeah. So we were not allowed to close. We had to continue, and we used that as a bargain chip with our employees as well, because our employees wanted us to close. And then we said, yes, if you want to close, you'll be without a job. I'll fire you. This is how it is, or you don't get any money. And after 2 weeks of negotiation and some tears, we all continued to work every day, completely normal.
Christian, were you just doing emergency, or were you doing elective work?
No, I expected that question. We did the patient journey. We altered a little bit. Be careful with the reception, plexiglass shields, and something to cover your heads, and no gowns, nothing. Just normal scrubs and just normal cross-infection protocols. And we continued treatment completely normal, completely normal. Even dental hygienist, I know that's a hot topic. Dental hygienist, I told them just use hand instruments, and they came back to me after 2 hours, said, look, if I only do that, I don't want to do the job anymore. And I said, all right, I trust you, do whatever you have to do, and get on with it. And as I said, we had 8,000 patient visits now from January, and we had 0 infections in the practice. Actually, because we had to part furlough our staff, we had less sickness because of the reduced stress level, which we normally have. We had less sickness, significant less sickness compared to the years before. Wow. So we had, like I said in our conversation, maybe I told you that, we had one dentist testing positive for corona. She had been in a bar on a Saturday and came to work on Monday and Tuesday. And she's seen around 20 patients, and she hasn't infected any patient. She hasn't infected, with the exception of her nurse, she hasn't infected any staff, and she's been with him for lunch and all that. And we got the results just 8 days later, because the German system was not as efficient as we would have liked it to be. But so the cross-infection protocols in our practice and dentistry, they work. So that was quite a long answer, sorry.
No, it's good, but what went wrong in England then? Why are we still not open? I even understand from the government sort of, on the 1st of May, they said, dental practices can be open. There's no restriction on them opening, except they're not open, and we're not treating patients.
It's very simple. If you try to have a look at how people get information in England in the dental world, you go to the GDC, they send you to the chief dental officer. You go to the CQC, they send you to the GDC and the chief dental officer. You go to the dental indemnifier, they refer you to the CDO. So you have the BDA, you have the British Association of Private Dentists, you have so many organizations, and they all refer to each other. The law is very clear, which regulates our activity. That's a 2008 Health and Care Act, I think, which regulates the CQC as well, and not a single law has changed. I expected the question, so there's a very nice YouTube video from JFH Law. Just Google YouTube.
Yeah.
And then they explain that very beautifully. And the problem is the CQC, which regulates the dental practice, is referring to the advice of the chief dental officer. But the chief dental officer is not responsible for the private practices. And only the CQC is. The GDC regulates the dentists themselves, but doesn't regulate the practice. So we're a little bit in a legal limbo here. And you have too many bodies regulating actually the same activity. In Germany, we have one body, and they tell you have to stay open or you have to bloody close.
Yeah.
And the government is very clear. Matt Hancock, the health secretary, has the power to regulate and direct the CQC under the 2008 Health Care Act. However, he has not done that. That means the regulations have not changed. And that means the government advice from me, the government, the executive of the government, or the executive is the government, has the authority to tell us to open. And they did that with the 1st of May. So for me, the legal aspect is, and I told them, I told the CQC by the end of March already, they will run into legal troubles. And they have now a lawsuit against them. Simple. Right. And I'll definitely join this lawsuit. Mm. There's a crowdfunding available from tomorrow.
Right.
So they have based their decision on very shaky grounds.
Right. Well, at best it's incompetent, but I suppose the other thing is there's an awful lot of patients not getting treated that really do need to get treated, and it is going to become a crisis in itself. Particularly with people with gum disease and that actually really need some proper treatment.
Do you know the famous book of British Smiles from The Simpsons?
No, who wants to tell me about that?
Yeah, Lisa Simpson has to go to get her braces, and they look terrible.
Yeah.
Then she doesn't want to have the braces, and she's shown the famous book of British Smiles.
Right.
So, and then you see all these teeth going in the direction. Look it up. It's quite funny.
That's a good joke. Yeah.
This is another chapter, unfortunately. I mean, for us, it's unbelievable that people are told by the dentist, competent people, told by Zoom or FaceTime, whatever, how to file down their teeth by themselves or how to pull out their teeth. That's impossible for a first world country.
It's crazy, isn't it? Christian, when do you think we're gonna? When do you think we're gonna open? Seriously, what's your best guess?
No, I don't guess. We will open on the 1st of June, and we will risk a lawsuit. I will be there, and I will treat my patients. I will risk the lawsuit.
Excellent, good. That's fighting talk. Good.
And I want to. I mean, today I just walked to work because I like walking a little bit. And in Germany, I just want to tell my colleagues as well. We will be back to work. We will treat our patients, and we will do what we love. There's no doubt about that. No? Germany is running as normal. Italy is seeing patients. France is seeing patients. Spain is seeing patients. Why not the UK?
Ireland opened today as well.
Ireland, I talked to colleagues. You introduced the lovely colleague to me. They're treating patients for a week or two already. So
yeah, well, they never actually closed. A little bit like you in Germany. They didn't actually close. They continued to treat patients. Essentially, just emergency, but they did some additional work, some elective work as well. Yeah. So it's just a mess, really. Is your
somebody needs to
vicious circle? Nobody's in charge.
Nobody's in charge because the CDO says I'm only doing the NHS. The CQC says we're listening to the CDO, although that's completely irrelevant for private dentistry at least.
Yeah.
So it is somebody has to say, all right, you know what? Let's go put protective equipment in place, protect your patient, protect your staff, get on with it. That's it.
Yeah.
And someone needs to have the balls or not balls to do it.
And you're going to have the balls to do it on June 1st.
What can we do? I mean, we closed now for 2.5 months. I have patients with temporary fracture, with implant temporary fracture. This is going to add up to the cost. Restoration is going to fail because I can't treat them. Yeah. Expensive restorations. And I have a moral duty to treat my patient. Of course, I expected that question. We do have a financial interest as well. Because if we can't treat our patients, we're going to close. Very simple.
If do you mind me asking about professional indemnity? So what did they say when you said to them, I'm opening on June the
1st? In my case, it's special because I have worldwide insurance, except Canada and the United States. So I can treat patients wherever I want. And I'm looking into buying German insurance now for the by Alliance for the English practice as well. But the indemnifier said the law is very clear. If you can prove that you have done the proper risk assessment, and if you can prove you've done everything to keep the patients and your staff safe, I think you can open. And the more colleagues open with us, the safer it is.
The restriction is going to be that, however passionate they feel about it, their concern is going to be around professional indemnity. So have any of your associates got UK indemnity?
All of them, but the verbal advice I got from them is that they would be covered.
They would be?
Yes.
Yes. Okay.
Not in writing though, verbally.
But, okay. So that's great. So your associates, when you open on June the 1st, will operate, deliver dentistry, not under the German, but under the UK indemnity.
Of course.
Yeah.
I will never force anybody to come into practice who feels unsafe.
Yeah.
And I leave it up to them because it's their reputation, it's their registration at stake here. But I mean, sometimes I think we have the moral obligation not to follow the rules and be there for our patients. It's very simple. That is for me, and I risk that. We risk that here in Germany as well because they recommended to cease aerosol generating procedures. And of course, you don't take that lightly. You have a look at the evidence, and I think you sent me one wonderfully written paper on aerosol generation procedures, and we read that, we do our conclusions, we get on with it.
And so what is your advice to UK practitioners around aerosol? What's your view on it?
We wear a hat, like a hair cover, because it's actually disgusting if you have all that in your hair and you go home and you kiss your wife with that. Then we have just a normal surgical mask. We have a visor, but we always had that. Then just normal scrubs and gloves and no long sleeve things, which we always disinfect up to the elbow. That's it.
And what other sort of changes have you made to your patient journey, or will you make to your patient journey when you open on June the 1st in Wimpole Street?
Proper information at the webpage. Tell them exactly what to do, not to be accompanied by friends or something, just come alone. Except you having general anesthesia or sedation, then they can ask somebody to pick them up. Information on the front door, only to enter the reception when there's one person, to wear a face mask when they come into the practice. Then when they, at the reception, we have a plexiglass shield for reception, and reception can additionally wear a face mask. That's actually what we require them to do. Waiting room is 1.5 meters apart. One other funny thing, in England, you have to stay away 2 meters, in Germany is 1.5 meters.
Really?
Yeah, it's completely.
Wow.
I mean, it's very simple. It's very simple. My explanation is because you guys are normally used to yards. Okay, that's 91 centimeters roughly, right?
Yeah.
You say 2 yards. That's approximately 1.60 meters, 1.70 meters. Yeah. So, but I actually read the government minutes. In Germany, they said initially as well 2 meters, but then they reduced it to 1.5 because they said actually 1 meter is fine as well. But they said don't trust the people to know what 1 meter is. And then if they say 1 meter, maybe that's really close. I can give them a hug as well. So. And they said went down from 2 meters to 1.5. I understand that. It's fine. Yeah. So the reception, then spacing in the waiting area. Then they ask to disinfect their hands when they come to the practice. Then we treat them as normal in the surgery. Whenever they want to show something in their face, they have to disinfect their hands again. And we finish the treatment. They go out, get their appointment, and leave.
Sounds straightforward. I know that a lot of my clients in Ireland are following that exact protocol without any sort of any extra protection. Can I ask you about the cost of the change in terms of production? So, you know, a dental practice can't operate in the same kind of way. You think it can?
We have not changed anything.
So your production is the same as it was?
Sorry, one thing I forgot, two things I forgot clinically. Sorry, I forgot that, very important. No evidence yet there, but this is a publication from Professor Bian from Wuhan. Rinse with 1% hydrogen peroxide prior treatment.
Yes, yeah.
And all the treatments under rubber dam if you can.
Yeah.
I mean,
say the last bit again, Christian, sorry?
Do all the treatments under rubber dam if you can.
Yeah, of course, yeah.
And I just prepared 28 crowns, so that's difficult under rubber dam. So I don't want to boast, but it's just a joy to be a dentist and just working.
Okay. But yeah. the cost of, the time cost of bringing the patient in and processing the patient in a slightly different way, and then cleaning down the surgery after each patient, is that not having an impact on your production time?
No. We always leave 15 minutes for removing the stuff which we use from the room, disinfect and bring in the new stuff. And we always have normally 2 nurses helping each other. So, and we had these nurses before as well.
So your typical scenario when you've got a patient in, you've also got 2 nurses as well in the same surgery?
Yeah.
Right. And you build in 15 minutes between each patient? We
always, you know, the surgical 15 minutes is most of the time 45 minutes. So the reception knows when I'm too ambitious again, want to prepare a lot of teeth in, let's say, 2 hours, they always add a quarter of an hour because I asked them not to trust me.
Okay. Well, yeah, it's biggest issue is running late, isn't it? Running over time.
Yeah, and I'm very often very late.
I think for a lot of practices, though, the interval of 15 minutes doesn't happen.
Probably, yeah. No, cross-infection is key. I mean, just imagine you want to go, if I go to my practice, I want to be as clean as possible, and I want to be able to be treated there myself. And if it's a shithole, I don't want to go there.
Yeah.
I'm very strict with that. I mean, we really like clean surgeries.
Yeah. And having 2 nurses is quite an extravagance.
Yeah, we don't have the two nurses all the time in the treatment room, except when we do surgeries or big treatments, but we have always one spare nurse, and that always pays off, because you have your personal nurse is getting less sick because she's not as stressed. You have help. If somebody gets sick, you always have a spare nurse. It's always worth it having it. We always have a spare nurse or two spare nurses in the practice.
Talk to me about hygiene. What happened with hygiene? Are you still treating hygiene in exactly the same way as you did?
Yes.
So no change.
1 hour slot, 110 euros. Get on with it. That's it.
So you always have a 1 hour slot. You don't do a 20-minute or a half hour. It's always an hour.
Always 1 hour, 110 euros, no exceptions.
And is the hygienist working with a nurse, or is the hygienist working by themselves?
Alone.
Alone.
Yeah. They're queens. I leave them alone. Yeah. It's their room. I don't touch them.
Does hygiene make a profit in your surgery, in your practice?
Yeah. We have two hygienists. One is on 40 hours, one is on 25 hours, and they turn over around 15,000 euro a month. Right. So that pays the rent. And they are on 30% roughly. 30%. Okay. Yeah.
And when you're delivering hygiene at Wimpole Street, what sort of, are you still doing the 1 hour appointments for hygienist?
Yeah. Wimpole Street, same concept. 1 hour
exactly the same. Yeah.
Exactly the same. There's no difference. It makes it easier for the reception. If you have 20 minutes here, half an hour there, the pricing is different. So the patients know I come in for 1 hour, I get my teeth clean, get out, it's 130 pounds, I go home. That's it.
Yeah. Brilliant. Excellent. What's the, in your, as you've got a foot in both countries, and it's fantastic to get this perspective. I mean, what would you say is the biggest difference between dentistry in Germany and dentistry in the UK?
The level of equipment.
Really?
Yeah.
We're poorly equipped.
I promised myself to make myself some enemies today. So yes, you're poorly equipped.
Really?
Dentistry in the UK, I'm sorry to say, that is 10 years behind roughly.
Is it?
Yeah. I mean, the problem is you're profit driven. In Germany, we're not profit driven. First, we set up a nice practice, get all the equipment in, give boys some money, and they spend it. Yeah. That's the problem with it. Yeah. So you get a CBCT. We tried always to have the best equipment, because it's just annoying if your instruments are not sharp, if your birds are blunt, if you can't take a CBCT or OPG or whatever it is. Top equipment produces top dentistry if you have the good qualifications to use it. Equipment. Invest in your dental practice, equipment, and invest in your staff as well. Train them until they sweat blood. Sorry.
and presumably you have no problem recruiting associate dentists.
Some associates wanted to leave me because they think I'm too strict, and I have to admit it's different here in Germany. They're not associates here; they're employees. Yeah. So I tell them to do it one way. They have to do it one way, otherwise I fire them. In the UK, I had to get used to the new way. The associates are their own employee, and they're self-employed.
Self-employed.
Yeah. So I had to learn to respect that. I can't tell them what to do in all areas. So I have to use different psychology. I have to encourage them. Yeah. And treat them. And the associates we have are very good. So and the grown men and women. So I have more resistance there, which is good. Challenges me. Very good.
Christian, that's been really insightful. Thank you very much. Can I ask you a small favor? Could I interview you again on June the 1st at the end of your first day back?
If I'm not in handcuffs, you mean?
I think everybody would like to know just how it went. Not a long interview, just a quick.
Yeah. I won't be in the UK because the problem is Mr. Johnson has not decided how long the quarantine will be.
Oh, okay. Oh, of course.
So I will be. It will be a little bit tricky for me, but you can interview. Yeah, I'll tell you how it went.
You can tell me how it went.
Yes, yeah. I will. And but I think, the discussions going on this week between the CDO and all the different bodies. I hope that they will come to their senses. I hope that this interview helps a little bit to reassure the colleagues and all the dental community that it's okay to come back and it is safe to come back. And our employees, they really look forward to do something. They're at home for 2 months now.
Yeah. It's kind of ridiculous. If we open on Monday, it's not going to be any different than if we open on July the 4th. It'll be exactly the same. practice that needs to get ready with a new patient journey, with some information for the patients, etc. But I'm hopeful it is going to get sorted out quicker than July the 4th. And why is it July the 4th and not July the 16th? There's no rationale behind that either. July the 4th isn't confirmed either. But I understand today there's a big meeting. They've got together hopefully today, and maybe we'll get some good news. But we'll talk to you on June the 1st.
Wish me luck.
I do, and thank you very much. It's very good.
Thank you very much for having me.
Appreciate your time. Take care.
Very much. Bye bye. Bye bye.